first of all, just to say that we at GFF are incredibly concerned around the impact of COVID-19 on essential services for women and children. And the health workers are really core in ensuring that during COVID, women and children can access essential services. The system that is anchored into the communities with community health workers, as well as the primary care facilities that do the first line of care for clients, need to be strengthened in a way that they can, first of all, can alert the system when something like this happened, and so can feed information up on what's happening in the front lines, and that they have the flexibility and the resources in the front line, and that they're well trained so that they can respond to these situations. And so we really see this as a tremendous opportunity to, in the immediate response to COVID, really double down on the frontline services, ensure that we support and empower health workers, including community health workers, to do their job. But in the medium term also, this is a big alarm for governments and for development partners around the fragility in the health systems and the need to really double down on strengthening the systems that to make sure that these frontline services can be developed under all circumstances and can be delivered in the best possible way with the highest possible quality. We're seeing in these frontline facilities that it's hard for health workers to do their work when they don't have the essential commodities or the protective clothing. And that's very much related with a strong focus on Africa, on the ability of countries to locally produce or produce in the region those commodities that they need during a pandemic. And then secondly, in the way health workers are trained and the monitoring of these facilities and the support to these facilities are organized, that can be done in a much more deliberate way, including through the use of technology, so that when pandemic happens, facilities are better prepared to respond to the pandemic. And in the medium term also, something we are very concerned around is around the proper financing of the frontline services. It's a really efficient and highly effective choice to allocate resources to frontline services, and we have to work with governments to ensure that domestic budgets make the right decisions and to invest in the highest impact interventions, and that also over time there's more domestic funding for the health system so that they are better prepared when pandemics like this happen.